Okay, everybody, welcome to the Healthy Joints, Healthy Life show. And I have the amazing Dr. Toyosi. She's a hematologist and she is going to give us some very important information that we need to make sure that we don't end up with some blood clotting issues when we're getting knee replacement. She's also going to talk to us about anemia and how that plays into when the patient is getting a knee replacement. So my name, everybody, is Dr. Arinola Dada. Welcome to the Healthy Joints, Healthy Lifestyle show. And I help people with autoimmune diseases get their immune system back on track, and people with joint pain become pain-free. So I am going to welcome Dr. Toyosi Onwuemene. And I am going to let her do her introduction because she's a phenomenal hematologist, and it's just a pleasure to have her here today.
Dr. Dada, thank you for such a wonderful introduction. I am Toyosi Onwuemene. I am a hematologist, and that means I'm a doctor who takes care of patients with blood disorders and a broad range of blood disorders, including bleeding disorders, clotting disorders, and definitely anemia. So for many patients who have autoimmune diseases, anemia is a big issue. So I'm excited to talk about all of these items today. Thank you for having me.
Wonderful. So, Dr. Toyosi, can you tell us a little bit about why you do what you do?
Wow, thank you for asking me that question. I started out a long time ago thinking that I would be an oncologist, which is a physician that takes care of patients with cancer. And along the way, it was so hard. I'm one of those empaths. I'm always I care so much about, and I like feel what others are feeling. And so it was so hard. Oncology was hard. And I have to say, one day I did a rotation and I was on the hospital floor and a patient had a major complication of a chemotherapy drug that really just bothered me. I thought I want to make sure that I am helping my patients get better and not hurting them with the drugs that we used to try to help them. And so really that was kind of like my about turn into hematology and thinking about, okay, where are patients not dying from their disease right away? And so that's how I ended up in hematology. But one thing about hematology too is that there's so much we don't know. And so part of my thing also is helping clinicians build research programs so we can better understand these diseases and we can help patients live better.
Oh, wow. And it's so like, oh, especially, I feel that way about oncology too, which is why I ran to rheumatology. but yeah. So, and there's so much that we don't know, and there's just so much opportunity for research. So it's so important to have someone like you to be able to help guide clinicians to be able to figure out kind of what their research opportunities are and be successful in it, right? Because that's a lot of work, and having somebody who's so experienced like you holding their hand actually allows them to kind of get the results they want. So I think both for patients and for researchers, I think your experience is invaluable. But well, thank you. Okay, so let's just get straight into our topic, right? How do you prevent blood clots when you're going for total knee replacement? Tell us.
Awesome question. Thank you for asking, Dr. Dada. So blood clots can be a common occurrence in patients who are undergoing any major orthopedic surgery, especially knee or hip replacement surgery. And so I think the most important thing is to first of all ask the question, have you ever had a blood clot before? And if you have, that's something you need to tell your orthopedic surgeon. Say, hey, I've had a blood clot before, and let them know under what circumstances you had the blood clot. And that's important because for many of our patients who are undergoing knee surgery, we actually will calculate the risk of them developing a blood clot with the surgery. And for patients that we think are high risk, we actually will start them on blood thinning medication around the time of the surgery to prevent blood clots from happening as well. Now, we don't do it for everybody, but patients who have risk factors, we usually will think about doing that for them about the time of surgery. So that's step one. If you have a history of blood clotting, if anybody in the family has had a history of blood clotting, especially related to surgery, definitely let your orthopedic surgery know beforehand. Number two is when they are trying to get you out of bed the day of surgery and you're like, please, doc, I just had surgery. Do not get me out of bed. It's really important because the more you're able to get up and walk around and start using that brand new knee or hip, the more you are able to kind of prevent blood clots from forming. And really, the bigger risk is in people who are not able to get out of bed, who are not able to move, who are not able to mobilize that knee, and that can increase the risk. That being said, we're not always able to prevent blood clots. And so at the first sign of any unusual pain in any part of the leg, especially that's unrelated to the site of surgery, or the first sign of any shortness of breath that's unexplained, definitely let your doctor know so that they can check for a blood clot and respond to it if needed.
That is so important, I think, almost for people to know before they go for surgery, right? Because you almost have to pep talk yourself. Because I think, when you've already, because you've gone for surgery, you're in pain, they're suddenly giving you pain medications. But if you kind of already know that another reason why I want to get up and follow instructions is not only because I want the knee to be successful so I don't get scar tissue, but I also want to prevent a blood clot, right? So I think going into surgery with just that mental awareness that, oh, when they're, you're tired, you're not feeling great, you're kind of recovering from the pain, they want to get you up and out of bed, knowing, hey, I do need to follow these instructions, and I do need to be aware that, oh, there's more swelling. I need to be thinking blood clot. We want to prevent that because if it goes into your chest, then you get shortness of breath and pain and all kinds of things that are very unpleasant starts to happen. So yeah, thank you for that actually. And I think that's important. So I'm actually going to have my patients watch this video when they're going for surgery, just to kind of prep them and just be aware that, one of the things that we want to guard against is, making sure that they don't have a blood clot after surgery. And then of course, anybody who's had blood clots before, irrespective of whatever is responsible for the blood clot, at least bring it to your physician's awareness. Right? So it's like, oh yeah, that was because I was pregnant. Oh yeah, that was because I was in a plane ride. Oh yeah, that was because I had a POP. Like, whatever it was, let's put that into the equation when we're calculating what your future risk is. So that's actually very, very helpful. Thank you for that. Okay. Do you have a story you would like to share about a patient who had an amazing outcome after being under your care?
Absolutely. So I will tell you that I'm an academic physician. Most of my time, about 70% of my time, is spent doing research and helping others be successful in research. And when I'm not doing research, I'm in the hospital rounding as a consultant. And so that means that I am supporting other clinicians as they care for their patients who have hematologic disorders, in addition to other things that they have. And I'm also helping clinicians who are young, who are in training, grow into their role as clinicians. And so some of that is watching them as they talk to patients, giving them feedback, sometimes when we're in the room, when we're out of the room, and also making sure that they're learning how to really communicate well with the patient. And so one of the stories I want to share is a story of a patient who actually at the time she had had anemia, and we were trying to work it up. And she had just recently been pregnant. And so we knew that a lot of it was related to the pregnancy. She had just delivered. We expected her to get better. But we were in the room, we're having a conversation, and all of a sudden the patient stops looking, she stops making eye contact, and her knees start bouncing. And I remember thinking, I was like, the atmosphere of the room has changed. We were having such a great conversation. And I stopped and I said, ma'am, I feel like something is wrong. What's going on? And it was so important because, it wasn't even necessarily related to the underlying disease, but it was communication. And it's one of the most important things that we do as physicians, is making sure that the lines of communication are open. And so when we're able to pause and find out that because I said bone marrow, all of a sudden she thought bone marrow equals bone marrow cancer. And she already started thinking that we were worried about her having cancer. And so it was such a beautiful thing to have the luxury of time to actually to be able to sense differences in the way a person is communicating or not communicating, so we can address the things that are going on. So I feel like many of the times my gift to patients is not even so much my knowledge of the disease, because to be honest, there's so much knowledge available, but it's really being able to connect with the person making sure that they're heard and making sure that their unspoken questions and concerns are addressed as well.
Wow, that was really good. That was really good. And so basically, so this was an unspoken cue that I noticed because you're just observant. You're pretty phenomenal. I was just listening to you talking about kind of all the multiple hats that you're wearing. So whether it is kind of in academics, and then you're done with the residents and the training, and then you're seeing the patients, and you're not in such a hurry that you're missing kind of the unspoken cues. You saw that, well, she's like, oh God, what's happening to my bone marrow? And you're like, okay, calm down. That's not what we're doing. And so thank you so much. I think on behalf of that patient, I want to actually say thank you so much for just being just the amazing who you are and just how you're managing to wear all those hats. And you just look so unruffled, and you're there and you're able to give her the time that she needed and to be able to help her through kind of that process. Wow, you're amazing, Dr. Toyosi. I mean, all of you.
Thank you, Dr. Dada. I know that your patients have the same experience as well. And I think that's one of the gifts I see that you give your patients, because when you have time to talk to your patients, you're able to answer questions that they haven't even asked as well. And so I'm grateful for the service that you provide to your patients.
So, I do have my fun question. So what superpower do you wish you had and why?
Superpower. I think the one superpower I wish I had was the power to read minds. Because then there would be so many problems solved, I think. Actually, problems created too, but problems solved. And I think I say that because, many times patients will come and they'll say, but you're the doctor. You're supposed to know everything. And you know what? We don't know everything. And we really rely on our patients to tell us when they need something, where there's a concern, or something doesn't match up. And so that's one superpower that I feel like would help my patients. But if I don't have that superpower, the second thing would be empowering them to speak up and not being afraid, recognizing that we are partners in this process. And for the partnership to work, we need our patients to step up and let us know what's going on, and let us know how we're not serving them or how we can serve them better, because that helps them do better and it helps us win as well.
Oh, yeah. So I think what I'm hearing from you, Dr. Toyosi, is that you would like the superpower of reading their minds. But if you can't get that, you want them to have the superpower of delivering their minds.
Yes, absolutely.
Yeah. So and I think it's so true. And a lot of times I think patients come in, there's a lot going on, and they're kind of concerned. They were like, how much of my story should I tell? How much is relevant? What's relevant? What's irrelevant? Right? Do I want to tell them everything? I tell my patients, I'm like, hey, open up. I'll be the filter. I'll be the one to kind of figure out, because you'll be surprised how the history of a blood clot that you had in the plane 10 years ago when you were pregnant is relevant to this new replacement that you're going to get, right? So I just say, just offload. I can take it, and then I will be the one to kind of filter out kind of what's what. So be careful. Dr. Toyosi is going to be reading minds if you don't come up and tell her what's happening. Well, thank you. I think this was just such a helpful interview. I think especially for my patients, people who have anemia and people who've had blood clots in the past. We do have conditions like, antiphospholipid antibodies, people with lupus who are more prone to blood clots. And so we always have this conversation. And some of the medications we use may predispose people to blood clots. So I think this is just very helpful. And the big thing about blood clots, as most of our patients know, is that the clot can go all the way into the lungs, and where it can cause big issues there. So wow. So this was actually a very fun interview, Dr. Toyosi. Thank you so very much. So can you tell us, where can people find you? Because I feel like I want to find you.
Absolutely. I will say that I mostly serve providers. And so patients who want to find me can find me at my institution, Duke University, and we'll be happy to serve you through that place. I am available also online. I'm on Instagram at CoagCoach. I'm on YouTube at CoagCoach. I do some teaching videos for for healthcare providers and some for patients who can understand. And I also am on LinkedIn as well. So please come find me. If it's a medical concern, I will refer you to our facility. But if it's a general concern that's not medical, I'd be happy to answer for your patient.
Thank you so very much. I mean, I would say that you're an amazing coach based on the interactions that we've had over the last 1 year. And I think that if anybody really was serious about getting their clinical research done, I think meeting Dr. Toyosi and having her guide you would ensure that you get the results that you want. So thank you so much, Dr. Toyosi, for coming to the Healthy Joints, Healthy Lifestyle Show. Hey, everybody, if you feel that this video has been helpful, please like it. Please share it. My name is Dr. Arinola Dada. If you have any rheumatology conditions or know anybody that does, we're in the greater Seattle area. Find us at overlakearthritis.com, and thank you for watching.